We got them working.
Yeah, they're working.
I might try to call back and see. It's good.
Yeah, let's keep it. Let's go. They just walked out. Don't. I know who's telling you. You need to tell that. If you know exactly who just tell him, I didn't say it. I told him to turn it off. I know, but that's, I never did. Yeah. He should have said it. Out here, see, that's about this. Yes. No, it wasn't, but that was not what was told. He did that already. You don't leave on people at all. In any capacity. Well, that is irritating. Oh, I see. In 1 minute. There's more chairs up here for all to sit. Somewhere we can sit out at the water. All right, it is 6 o'clock. I want to welcome everyone to the January 2025 meeting of the Scotland County Board of Commissioners. At this time, I'd like to ask Commissioner Williams for the invocation.
If you would bow your heads, please. Oh, merciful and gracious Father, we come to you tonight, giving you all the honor and the praise. Lord, we thank you for giving us another year. Hopefully live and do your will on this earth. We ask you to touch those families that were affected in New Orleans during that horrific event. Bring them peace, bring them joy in your way. And I ask you to touch every commissioner up here tonight so that the decisions we make tonight be for the betterment of Scotland County so that we can grow in the direction you wish we should. In your name we pray. Amen. Amen.
Stand for pledge. I pledge
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
At this point, we're at point to approval of the agenda, but you can make an addition, and we're going to put it in under number after number 3. The sheriff would like to address the board. And we'd also like to move up item number 9 up under number 6. So they can all do their presentation. That's the same group. So with that revision, do I hear a motion for the agenda?
I'll make a motion.
We have a motion and a second. Any other item? All in favor? Any opposed? All right. At this time, we'll open our public forum. Ms. Sanders, do you know if we have anybody for public forum signed up previous to speak? Okay. Does anybody would like to speak for their time for the public forum? Seeing no one dashing for the mic, we'll move on to the consent agenda. And need a motion for the consent agenda. Yes, we have Commissioner Williams and Commissioner O'Neill second. All in favor? Aye. Any opposed? All right. At this time, we're going to have a recognition of Commissioner John Alford, and I'll ask John to come up. It was on the agenda to as well for Commissioner Gibson, but he just texted us and said he had something come up, he can't come, so we'll get that to him. But this is a recognition, and I'll let you tell, how long were you on?
20 years.
20 years.
Father what?
In grateful recognition of your outstanding service and dedication to Scotland County, presented on January 6, 2025, by the Scotland County Board of Commissioners. Mr. John Allen. Yes, sir.
The floor is yours. I just want to thank all of you for your support over these past 20 years, 5 consecutive terms. And I thank you for bestowing that honor upon me. The government is by the people, for the people, and of the people. And I appreciate that. And I just love working with this board. And I know that the county's in great hands with the new one. Oh. And I just thank you so much, Scotland County, for supporting me. And I hope I didn't disappoint you. Thank you very much. My place is in the back.
Yeah, what am I told?
Oh, boy.
Thank you all very much.
Thank you, John. Right. Thanks, sir. Appreciate you. All right, our next item on the agenda is Trillium Health.
Good evening. Thank you so much for having me in, Chairman Ivey and Commissioner. I'm here just to provide a mid-year update on Trillium's launch of the Tailored Plan benefit plan and Medicaid managed care in North Carolina and here in Scotland County. First, I'd like to thank the Commission for appointing Commissioner Williams to our regional board and former Commissioner Carol McCall. We have some wonderfully strong advocates on our regional board, really trying to make sure that the residents in Scotland County get the mental health, substance use, and developmental disability care that they deserve. So we appreciate that commitment. Next slide. So just as a reminder, Trillium is the local management entity and managed care organization, and we are now covering 46 counties. We cover services for those with serious mental health, substance use and developmental disabilities, as well as traumatic brain injury. And we serve those who have Medicaid and also who have no insurance or are underinsured and have behavioral health needs. And so our number is listed there as well as our website. So if people are looking for services and resources, please don't hesitate to contact us. Even if you're not part of our plan, there may be some things that we can do in terms of crisis care and training that we can offer to the public. Next slide. So North Carolina has been in the process of Medicaid transformation for a couple of years now. And before that process was started, the LME MCOs covered all of the behavioral health services for people who had Medicaid throughout the state. And then the physical health services were covered by a separate network statewide. So what North Carolina Department of Health and Human Services wanted to do is have their health plans serve a whole person, both the physical health needs and the behavioral health needs of their members. So they started implementing whole person care with standard plans, and those are the commercial plans that you'll see listed on that left side: WellCare, United Healthcare, Healthy Blue, AmeriHealth Caritas, and Carolina Complete Health. So those standard plans are contracted with DHHS to serve Medicaid recipients who have low to moderate behavioral health needs and also physical health needs. The LME MCOs have been working toward becoming tailored plans for the last couple of years. Tailored plans are whole health plans that serve individuals who have the most significant behavioral health needs. And so we launched as tailored plans July 1st of 2024. And that's Trillium along with the other 3 LME MCOs, Partners, Alliance, and VIA. Next slide. So we get asked a lot about the difference between a standard plan and a tailored plan. Folks are looking to figure out, which plan is appropriate for them. So the difference is that standard plans offer basic outpatient services because they're serving those with low to moderate needs. And so they can typically be served by outpatient treatment and medication management. They do also cover more intensive substance use treatment to try to reduce the barriers that people have to receiving substance use, get them access as soon as possible. And then there's a service called Child First that's available as an early intervention service through Medicaid, early periodic screening and treatment. Trillium and the other tailored plans serve those who have more severe needs, and so we offer something called enhanced services, and then we also offer residential services. So those enhanced services are things like child and adolescent day treatment, so serving the mental health needs of children who are school age, multi-systemic therapy for children who have significant behavioral issues and maybe are at risk for being involved in juvenile justice, assertive community treatment and community support team treatment for individuals who are adults who have severe and persistent mental illness, and then ambulatory detox, or in terms of residential and medically monitored residential treatment. Then for adults with IDD, we operate group homes. We contract with providers to do that, as well as for children, we operate psychiatric residential treatment facilities and intermediate care facilities for adults with developmental disabilities. So those are some of the options that are available through tailored plans and some of the differences in the types of services we offer. Next slide. So as I mentioned, we did launch the tailored plan in July 1st of this year. We're about 6 months in to providing services as part of that plan. So as part of the tailored plan, not only are we covering those physical health needs for tailored plan members, but we're also covering a couple of different pieces of those services. Non-emergency medical transportation, we cover pharmacy benefits for our members, medical equipment, and then long-term services and supports, things like nursing home care, personal care, and home health care. So our tailored plan members are eligible to receive a service called tailored care management, and that is really kind of the cornerstone of our tailored plan service. And that is the development of a plan of care that is monitored throughout the year. And that tailored care management can be offered both by Trillium and by care management agencies or advanced medical homes that we contract with. And it is really designed to empower our members to have a plan of care, to get invested in their overall wellness, and then to receive the support they need to continue to receive both their physical and health care throughout the year, and also to address some of their social health needs that really play into how well they are doing overall in their community. Our care team consists both of individuals with clinical behavioral health expertise. We also have doctors, nurses, PT and OT. So we have those experts on the physical health side to be able to understand our members' behavioral health and physical health needs. Along with Trillium providing tailored care management here in the county, we are also contracted with Primary Health Choice as another tailored care management provider here. Next slide. So there are a couple other services and benefits that are also exclusively offered through the tailored plans in North Carolina. One of those plans is the Innovation Waiver Service. It's a separate set of enhanced benefits just for individuals with intellectual and developmental disabilities. It allows people who would otherwise qualify for an institutional level of care to live in their community. It is a more expensive service, and so the number of individuals who receive those waivers are limited. There is quite a long waiting list, so we encourage any family whose child or adult child with IDD to get on the waiting list so that they can have access to these services. Another set of services that are similar but come with kind of less hours, less funding are the 1915I services. So those are home and community-based services that mirror the Innovations Waiver Services, non-clinical but supportive in the community. The TBI waiver services are going to be expanded this year by the North Carolina Department of Health and Human Services. So we are onboarding providers to expand the services that we're able to offer under that TBI waiver. And then we also continue to receive state funds through North Carolina DHHS, covering people who are uninsured or underinsured and needing behavioral health, IDD, or TBI services. Next slide.
Excuse me. How do you connect to people who are uninsured for those behavioral health services?
So we do community outreach. We participate in events. We're involved with community meetings to try to make sure that our community partners and the public are aware. And obviously, being here, sharing information, we want to make sure that people know that those services are available. Our providers also, we have a no wrong door policy. So if someone was to walk into a provider's office and say, I need behavioral health care, or if someone goes to the emergency department needing substance use, behavioral health care, the emergency department can connect them with one of our providers that will cover those services through those state funds, and they can walk right in and start receiving services right away. Absolutely. And we're always looking for outreach opportunities to make sure that the public is aware that those services are available. So one of the questions we get, that was a really good question, one of the questions we get quite a bit is how people are eligible for the tailored plan. So different from standard plans where anyone with Medicaid who has a low to moderate behavioral health need can choose between some of the different health plans like Healthy Blue and AmeriHealth Caritas. Members are assigned to our plan typically, and it's because they need one of those enhanced services, or they have used a service like that in the past and continue to need that level of care. So some of the ways that people become eligible is if they use a drug and alcohol treatment center, or have an inpatient stay at a state psychiatric hospital, or if they use behavioral health crisis services or visit an emergency department for psychiatric needs 2 or more times in the course of a year. They can also be auto-enrolled by DHHS based on either a diagnosis of serious and persistent mental illness, or because they've used enhanced services in the past. One of the pieces of launching the tailored plan is that all members were encouraged to choose a primary care doctor, and they still are. They can, if they did not choose that at the time that we launched our tailored plan, they were auto-assigned, but they can make a change to a preferred primary care doctor if they would like. And as I mentioned, Trillium and another tailored care management provider are here to offer that tailored care management service. Members can choose between providers based on their preference, who they'd like to work with. Next slide. So here are some of the numbers in Scotland County. This is state data as of July, so we try to pull some state data and update it every 6 months, so we're gonna do that fairly soon, and we'll have that for when I come back for an annual report. But there were a little bit under 17,000 people who were receiving Medicaid in Scotland County as of July. Trillium is covering about 28% of that population, and then those commercial health plans, the standard plans, are covering about 72%. So your largest, in terms of enrollment, standard plan provider is Carolina Complete Health. And then in terms of Trillium members, we have a little over 1,300 who are actually receiving that whole person care, the tailored plan benefits, and then around 3,500 that are still in Medicaid Direct. And those are the individuals who receive Medicaid but are carved out of managed care because another entity is providing that primary care or the physical health care services for them. Typically, it's people who have Medicare and Medicaid, where Medicare is covering the physical health services. Also, children who are in foster care or former foster care youth are carved out of managed care. They will soon be covered by Healthy Blue or Blue Cross and Blue Shield through a separate foster care plan that is, I think, anticipated to launch early next year. Next slide. So with every launch and change to Medicaid, there's a period of adjustment, and we certainly were not immune to that. One of the most significant changes that we experienced as an organization was an increase in call volume with our call center. So just as an example, in June, before the tailored plan launch, we had a little over 9,000 calls. In July, it bumped up to almost double because members are curious about getting coverage for primary care, transportation, and the tailored care management service. We also saw an increase in claims, and actually, in terms of claims, the last data that I have is for October. That's up to a little over 377,000 claims that we received in October. And there's a lag in claims of about 3 months, so that number usually goes up after we report it. All of the tailored plans are contracting with a transportation provider called ModivCare. They're almost 100% statewide. I think there's one plan that uses another transportation provider. So we're working very closely with ModivCare because we know that some of our members have experienced a disruption in their transportation schedule. And we're trying to work with them to make sure that our members both get to their appointments, but also have access to the type of transportation that works best for them. Because our members have such specific mental health and developmental disability needs, they often will need a reliable and consistent mode of transportation. And so each of those concerns that comes to us, we're working with our members and ModivCare to try to make that happen. And then just to give you an example of the volume that we're receiving with those pharmacy benefits, from July until mid-October, we paid about $82 million in claims for pharmacy benefits. So with the increased call volume, it's taken us longer to respond to calls to our call center. We're trying to make some adjustments. We've increased staffing in our call center. And we've also created some kind of directions for calls. So if people are calling for the nurse line, they get directed to press a number and get to the nurse line. Same thing for transportation, so that those calls that need to be answered by call center staff around connecting members to care, we're able to do that more quickly than we have been during the first couple months of tailored plan launch. One of the good things is that we continue to have 99.9%, around 100% of Medicaid and state claims paid within 30 days. So ultimately, our members are getting services and our providers are getting paid so they can continue to operate. And that's really the key to making our tailored plan work. We also, in terms of that transportation, took an extra effort to make sure that there was no member who received regular transportation who was not connected to a trip at the beginning of tailored plan launch. So it was kind of an all hands on deck situation to try to continue to support our members through that transition. Next slide. And then one important piece with tailored plan and tailored care management is addressing those non-medical community health needs. So things like housing, transportation, food access, safety, education, employment, and social integration. So Trillium does that in two ways. We have our Neighborhood Connections team that assists our Medicaid recipients to connect to community resources and also internal resources to help with those things. We also have a Trillium Advantage plan, which is value-added services that help with stabilizing resources. So we can provide our members with GED vouchers to help them take the GED test and be more employable. With transportation outside of those medical appointments, so if people need to have support to get to the grocery store or to get to housing appointments, we can provide them with some support around that. We offer our members a recovery app to help them manage their substance use recovery. We have move-in assistance for helping with housing stability and some incentives to participate in that care management service. Next slide. And this is just a summary of some of our member lines, our behavioral health crisis line. There is really no wrong door for people to access care during a behavioral health crisis. So if you take away anything, I would say people can call 988 or they can call our behavioral health crisis line and they'll be connected to a clinician and a service to help de-escalate that crisis and direct them to resources so that they can continue to be stable in their community. And then for other needs and for training and some of the community resources, we offer our administrative and business line of care. And that is all I have for you. I appreciate you taking the time to hear this update.
Thank you.
Thank you very much.
Any questions? Any other comments? Thank you, ma'am. We appreciate it. Moving on, before we do that, can somebody check that microphone and see if it's on? I don't know that it's on. Not so much for the room, but for the people. It's not broadcasting. Camera's not broadcasting. Yeah, it's good. It's for the people listening online. Just notice that. All right, we'll move right along and go ask the sheriff now. Agenda.